Hi, my name is Nancy Balalakau, and I'm here on behalf of National Asian American Theater Company, and we're very proud to present this conversation on advocating for aging communities. This conversation is in conjunction with NAATCO's world premiere of Out of Time at the Public Theater. I'm going to start with Yi and ask everybody to introduce yourselves.
Hi, my name's Yi. I'm the Policy Research Associate at the Brookdale Center for Healthy Aging. I'm sorry about the noises in the background. I support Center's policy initiative through qualitative research and community outreach, while researching a broad range of topics, including health, law, education, and employment. I'm also specifically interested in the research at the intersection of race, age, and technology. I received my MA in Science and Technology Studies in Anthropology from University of Chicago before joining Brookdale. A year before, I also served as a case manager, serving for Asian immigrant survivors of violence in Massachusetts for a year. So I also work a lot with Asian older immigrants and have a lot of experience working with them and learning their perspectives.
Ruth?
Hi, I'm Ruth Finkelstein, and I'm the executive director of Hunter College's Brookdale Center on Healthy Aging. I'm also a professor of urban public health at Hunter. And I've been working for some time now to help reframe our understanding of aging away from thinking of it as sort of disease and decline and disability toward thinking about it as another stage of life and one that can be as good as we as a society design it to be. So we've sort of flopped the responsibility for aging well onto individuals and made it seem like, oh, you have to save all this money and you have to do, exercise and get this house and do this and do that. When in fact, I would argue that we need to design our city, our neighborhoods, our communities, and our opportunities in a way that people of all ages can take good advantage of that.
Thank you, Ruth. Michelle?
Thank you, Nancy. My name is Michelle Arnaud. I am the Vice President of Great Panthers NYC. Great Panthers was founded in 1970 by Maggie Kuhn, who had been forced to retire at the mandatory age of 65 in 1970. And she felt that she still had a lot of energy and a lot to contribute to the world. And indeed she did. So she started this movement based on the concept of Black Panthers, but Gray Panthers in fighting against ageism. And our motto is action and advocacy against ageism. There still are 10 chapters in the nation. And the New York chapter is accredited by the United Nations, and we address them yearly to protect the rights of older adults. Our current platform is fighting with Chairman Kim to protect people who are living in long-term care. Older people account for 34% of the deaths from COVID, but fewer than 1% of Americans live in long-term care. We need to protect older adults, and all of us should be lucky enough to become older adults.
Ron?
Thank you. And it's a pleasure to be here with everyone. I am the chair of the Committee on Aging in the State Assembly. My name is Ron Kim. I have been in public office since 2013, serving out my 5th term. During this COVID, I've been focused nonstop on exposing what I call the elder side of the last few years. These are policy and design choices that led to tens and thousands of older adults in New York State. Alone, we've had more than 16,000 older adults who passed, mainly in places like nursing homes and long-term facilities. It's important to coin these terms correctly, in my opinion, because that's the only way that government, policymakers, and the public understands the mistakes we've made, but it's also a way to combat ageism moving forward. Currently, like, I'm consumed by what we can do every single day, whether it's politically, policy-wise, or culturally, to change the narrative around how we perceive older adults. You can see it when you walk around places like my district in downtown Flushing. When we have rezonings, when we put upgrades on our street sidewalks, we don't consider the needs of older adults and any elements of changes in our backyards. And I think there's so many things that we should be doing to mandate how we perceive, long-term sustainability, especially because we're at a full crisis, as everyone knows in this space. In the next 30, 40 years, the 65 plus population will quadruple in size, and our long-term solutions are nowhere near where it needs to be to address an aging crisis in this country.
The issues that you're all speaking to already existed, but now COVID has inflamed everything and made it much more urgent and has made it a crisis. If you could each share what you think from where you are, what are the pressing issues right now?
The Great Panthers NYC is very concerned about policy and long-term care. Last year, we produced a documentary called Day of Remembrance. We tried to provide an outlet that people could dial into in order to acknowledge the grief that we all felt. Not, well, just because we're isolated in any case, but we lost our beloved family members, and there was no recourse at the time. So we created this documentary, and now we have a monthly webinar, which we're calling Transformation Tuesdays, at which experts in the long-term care industry are gathering to suggest ways that we can change policy and what we, even citizens of New York, can do in order to make life more comfortable, more equitable, and to address everything that went wrong in the last 2 years. In February 15th, we're going to have a webinar entitled Omicron and Ageism in Nursing Homes. We just had a webinar about fair pay. This is another huge issue. People who work in nursing homes or who take care of people at home are not paid as much as a dog walker. These are inequities that we can all sign petitions, work toward, help Chairman Kim with his bill to try to make things more comfortable for all of us as we age. And we want people to age in place. We want to have naturally occurring retirement communities. We don't want nursing homes to be a 4-letter word.
Michelle, do you find that in light of the past 2 years that the Great Panthers are, that people are paying attention or, logging on for the webinars? And do you feel that that there's more awareness growing?
Yes, our visibility has increased, and we are able to give a platform. Even if nothing changes, we can offer the Zoom platform to those people who would like to express their thoughts, actually on any side of the issue, but hopefully on the side that's going to be improving where we are today.
Ron?
At the peak of the pandemic last year, our former governor and many other states following his lead gave out near blanket legal immunity for some of the worst nursing home executives and hospitals across the board retroactively. So meaning if you went to a hospital in the middle of the pandemic in March, you had all the rights as a patient and recourse. He went back and took those rights away from you. I helped repeal that law, but now I'm hyper-focused on strengthening older adult rights, which is what we used to do during these type of downturns and crisis. We have 25 years ago passed the Nursing Home Bill of Rights at the federal level, as well as the state level, but we walked away from going to center solutions around families and workers, to hiding behind words like industry stability, as these nursing homes and hospitals walk away with billions and billions of profits during this COVID. So I'm very much focused on right now making it very expensive for the state and the industry to disregard, mistreat, and abuse older adults. We have a law in the book, called the wrongful death statute in New York, that says that if you are an older adult and you die negligently, your life is not worth as much as someone who works on Wall Street, most likely a man. And that because our economic value is determined in a very outdated law that was written like 120 years ago. We need to repeal that. We need to factor in the intergenerational knowledge, the trauma, and value everyone's lives, especially older people's lives. Otherwise, people's behavior, nursing homes and these type of facilities will not change. And secondly, we need public good. For the last 10 years, we sold off dozens and dozens of public county-owned facilities that pay good wages, that give retirements for the workers. We privatize all of them, and we haven't had any plan to strengthen the public sector to hold our ground, that not the care sector shouldn't be entirely privatized. There has to be a mixed balanced economy here, and we no longer has that. In New York State, only 4% of the entire long-term facility is public, and everything else is mostly privatized now.
If anybody has a response or would like to speak to what Ron just shared.
First, the absolute center, and particularly at the beginning of the COVID crisis, was in long-term care facilities. However, it expanded in two different ways that I want to talk about. First, it expanded to other congregate care facilities. And we really realize that there's one kind of epidemic that is driven in the community and a set of strategies to deal with it. And there's a different kind of epidemic that's driven in congregate facilities with a different set of policy strategies to deal with that. So I would add, while we don't like to think of prisons and nursing homes in one sentence, and other for long-term care facilities for people other than older adults, in fact, they, as well as shelters, have in common that they're places where people are put together, not living according to the rules that inhabitants make, but living according to rules that broader administrators and authorities make. And those rules have not been conducive to appropriate prevention or treatment or the consequences of COVID. And that's been true in the long-term care facilities, less so thanks to the attention that these folks have, these and others have brought to it, but still true. But it continues to be very much true in our prisons, our jails, our shelters. As you all know, COVID didn't stay inside of facilities. It rapidly spread. 80% of the people who died of COVID are older adults. Now, as the epidemic continues, the numbers of people infected by COVID changes into a wider age span for whom the virus is not as lethal. The association between COVID and age has been a great reinforcer and creator of ageism. So this image that we can all see in our mind of a frail, isolated, older person alone behind a sheet of heavy glass has become kind of the image of the epidemic. And while it is absolutely tragic that there would ever be such a person anywhere, research has shown that older adults living in the community have actually felt less isolated and lonely than younger people because we have the experience, the resources, the networks, and we've been here before, and the resilience through extraordinary events, and many of us have done so through extraordinary events before. And so we need to complicate the narratives about COVID to allow ourselves to see those older people who are offering lessons and are role models to all of us. So I'm not taking away from that narrative, but I want to add to that narrative the people who describe the ability to connect in new ways, to learn new things, to pursue new interests and hobbies, even to meet new people through new modalities. So I'm sure we'll go on to talk about the way that there are barriers to use of technology for lots of older people, but there's also been an amazing learning of new technology. I'm so proud of so many people, including some people on the screen right now, who are doing things that we didn't do before and are continuing to grow and learn and write music and write books and act in plays and pursue interests that we never were still enough and sat with ourselves for long enough to do.
Essentially, this narrative of elders dying in isolation is a way of taking away their humanity in a very callous way, saying, I'm okay with that as long as it's not me. Thank you, Ruth. I think, Yi, you come from a different perspective of relating very directly with a community. Can you share what you're seeing and the issues that are coming up for the people you're in touch with?
What I'm coming from is that I still want to, touch on the lack of meaningful access to technology right now, because still, even though there's a lot of efforts being put into the technological innovation for accessibility, there is still some lingering issues faced, by older adults. I still remember when the COVID started, this when the state declaring emergency, staying home ordering emergency. One of my client told me that she have overcome so many difficulties of leaving her abusive house at an older age and really try to stay input and stay brave throughout this process. But she really felt crushed at this moment, as she really felt that as a lot of things are shifting online, she feel like she is particularly isolated. I guess what this pandemic taught us, on the one hand, you see how increasingly important technology, especially information communication technology, play in our lives in keeping us safe and connected. But on the other hand, you also see how what this pandemic also has brought to your attention is this enlarging digital divide, and that further aggregates a lot of existing inequalities faced by our older adults, especially immigrant older adults and older adults of color. In your city, there are 400,000 immigrant adults, just adult older adults in general who are 60 and above who lack access to internet, which means they lack access to electronic devices and broadband. And I also want to make it clear that meaningful access doesn't only mean the ownership of electronic devices, but also means, first of all, to have the motivation to get online, and also having the skills to navigate resources and information. It is worth noting that every year, older adults nationwide lose $40 billion to cyber criminals. These scams include scams specifically target older adults, and also just scams in general, which older adults are more likely to fall victims of because of their lack of experience using computers and navigating information online. There is a lack of free and public tech education programs for our older adults to utilize in the city to really let them know how to use technology that serve their genuine interests and keep connected with other people and cope with social isolation. More than half of older adults in New York City are rent burdened, but although like NYCHA, New York's Public Housing Authority, do provide really affordable housing to senior adults, but the poor maintenance of these housing usually make it really hard for these older adults to stay healthy and stay comfortable. They also face a lot of accessibility issues. 70% of rental units in the city are only accessible by stairs. And that also is also applicable for public transportation, that only 1 in 4 New York subway stations have key accessibility features. Ageism, age is not an isolated factor from other social factors. One's aging experience also really impacted by other social factors such as race, gender, ethnicity, and class. I think all these things are really systemic, and we cannot really talk about age in isolation of many other factors. The fact that older adults of color are more likely to live in a really hostile environment, lack of comfort, and also as we see right now, older Asian seniors are becoming a likelier target for anti-Asian crimes. And we also see all these trends all together. So I guess the finish point, the end note is that all these things need to be kind of treated all together.
Referencing what Yi shared about the workshops that help older people learn more about technology and how to use technology and stay safe. If there's the average person that wants to help, what kind of programs do you recommend and support that people can either donate to or volunteer at? How can we change and support the work you all are doing in a very concrete way?
I think in this space alone, we're represented by different groups, like the Great Panthers and so many other community-based organizations that are doing advocacy work. There's also, because of COVID, volunteer family advocates, like one particular, like Voices for Seniors, that started last year, that have done work for families throughout the state. But in terms of the policy work, holding your local elected accountable to policies and issues that we care about, there's a menu of different types of bills that, for the most part, to be quite frank, we're just putting band-aids on so we can survive another day for older adults. The long-term bills, the long-term solutions will take more of a movement to get them done, because in places like Albany and other states, we're going up against multi-billion-dollar industries that do not want change, that they want long-term care facilities, as well as intermediaries like managed care systems, to be even more privatized. They're just waiting in the sidelines for private equity firms and hedge funds to take over the healthcare systems piecemeal at a time. And there's so much money behind it. And, people in powerful positions, like any executive in the governor's position, they come out and give a lot of platitudes when they talk about budgets, but the details still protect the status quo. All it does is give hospitals and in these industries who are donating so much money to politicians more legal protection. And we as a public can start calling out those politicians that are taking so much money from the special interest groups and lobbyists. And if we can start with those type of discussions and asking politicians not accept those type of donations because their values are compromised, and focus on people-driven models and people-driven solutions so people can age at home, then we can finally, as Michelle pointed earlier, rebuild the foundation of home care work, because right now, not only are we not paying people this current minute, we owe billions and billions of back wages of home care workers, predominantly immigrant women workers going back 10 years. We all talk about the need for the care economy and protecting older adults, but the foundation of the care sector is based on exploitative work of mostly immigrant workers in our own neighborhoods. And so these are the uncomfortable conversations that we need to put out to elected officials all around the state so we can hold the system accountable and make the changes that we need.
The eldercide that occurred under former Governor Cuomo, that has been to a degree recognized and moving towards being addressed and corrected. Do you feel that something came of that? Our current governor, does she have a different attitude? Do you see that you're getting more support now that that has been called out?
Yeah, it's definitely on the surface, we went from like a dominating, Cuomo culture to more of a partnership and collaborative governor who's willing to call me and sit down with me and try to, at least on the surface, build partnerships. But it's still yet, and I haven't determined whether that empathy translates into real policies and transformative change yet. I think Ruth touched on the president, elderly and president earlier, and she's nowhere close to even talking about that subject. So I think it's moments like that we also need to be very careful about whether we are consumed, the public that is, by identity politics and performative politics, and whether we're allowing people to leverage race, gender, to do the same damaging policies that have protected the status quo. I've wrote an op-ed to this when Governor Hochul first became governor, that we need to thoroughly vet her, that we need to ask the tough questions while we can, before she has $22 million in the bank. She raised a ton of money. Now she's almost untouchable. Now she's got $22 million and she thinks she can do whatever she wants. She's just going to get reelected.
So I want to talk about cumulative advantage and disadvantage, which is the big science name for the simple idea that the rich get richer and the poor get poorer across their life course. What we see happens is we all know that there are huge disparities in society in our country, and we know that they have patterns. We know that some groups of people are almost always on the losing side, and other groups of people are almost always on the winning side. What everyone doesn't understand is that those disparities grow across our life course. So the opportunities that you have if you're born with privilege and go to good elementary and high schools and colleges and jobs and marry other people in similar circumstances and inherit wealth from your parents who had those similar circumstances. Shockingly, those are the very people that have a greater probability of living a long and healthy old age. At the same time, those people for whom the opportunity structure across the life course is not there. And so people whose schools are not ideal, and education is the single biggest driver of the phenomenon I'm describing, who don't have educational opportunity and then job opportunity, and then economic opportunity, and then intergenerational wealth transfer opportunity, and so on, become poorer and poorer and poorer. And we have these large differences in life expectancy, which is just the crudest of outcomes, right? So it's actually the case that richer people live longer. What that means is that advocates for older people need to be advocates for high quality education for everybody. Advocates for well-being in old age need to be advocates for well-being among youth and young families. We need to be advocates for career development. There shouldn't be one opportunity to enter into the doorway to get it right. There should be as many opportunities as there are people. One of the ways that we're trapped in this, in our silos, where we care about this person and we care about that person, is that we fail to look at the big pattern, and we fail to see who benefits as well as who doesn't.
COVID has made it so much harder for people to have empathy for, the other. I think in some ways there has been more opportunity to connect and to shine a light on all kinds of issues and biases in this time. But it's also, I think everybody struggles in their respective isolation. This is like a very pop cultural component of this idea, but I saw this TikTok post, which maybe you all have seen, around the time that Betty White passed, that the Golden Girls, when they premiered, B. Arthur, Betty White, and Rue McClanahan were 55, 56, 53. And just like that, the new Sex and the City reboot, Sarah Jessica Parker and I can't remember, Cynthia Nixon and Charlotte are the same age. It's very interesting to have seen them as young people in all of their romance and sexiness of that kind of life, and now to revisit those beloved characters and see them struggle through things like loss of hearing or the loss of sex life in a marriage. I feel that things like that really help to shift thinking and also see yourself in a different experience.
I just want to go back to also what you had asked earlier, Nancy, about are there organizations that exist to support people who want and need technical advice or everything about technology. And there's a fantastic organization called Senior Planet. I'm sure you all know about Tom Camber. He's like this genius. He had helped an individual 80-year-old to get online, and I don't know, this is like 10 years ago or so. And he suddenly thought, hey, you know what? I could do this for everybody. And also shout out to the libraries. The libraries used to do this. They used to provide everything. And I always say, it's like television. You don't really know how that image of Sex and the City got on the screen, but who cares? You turned on the TV. Same thing with technology. You don't have to understand all the background of it. And also, I'm on the board of the West Side Interagency Council on Aging. Every borough has a council, an interagency council. There are free resources that you can just call. It's not all horrible. It's just
a shout out to senior centers too. Every city and neighborhood and community has a senior center. Many have online programming. All of them have phone information, referral, and services. Many have expanded their capacity to connect with people remotely and to help people with their technology problems. And I need to add a shout out to many of the cultural organizations around the city and state who have greatly expanded their online programming and services. And so this is another one of those kind of backdoor benefits of COVID, is that much more is available online than used to be, so that you can see plays and you can hear music and you can attend exercise, every kind of exercise, arts engagement. The thing where people are doing group singing is a little better to participate in than to listen to, but it's still incredibly fulfilling. There's been real innovating on the part of those major cultural organizations, the theater community, as well then as linking organizations like University Settlement, like Arts and Minds, like Creative Aging, who have tried to move their programming and relationships between teaching artists and individuals into the virtual environment.
Just the reason that we've come together today, NAATCO Mia Katigbak with a co-founder for NAATCO, I believe the origin story of this project is related to having been in isolation during COVID. Their upcoming show, Out of Time, at the Public Theater, is a collection of monologues, all written by women, and feature actors all over 60. The Public Theater has been incredibly supportive. I think, again, it speaks to the kind of cultural change that helps to shift people's attitudes. I just wanted to go to Yi for a moment. Are you encountering with your constituents issues around anti-Asian violence?
I also work for the qualitative research team at Brookdale, and we are currently working on a project that kind of learn from older adults, their perspectives on health messaging. And I specifically work with Chinese Americans in senior centers. So I conducted a couple group focus groups and also individual interviews with these older adults. They're all above 65 years old. One thing that was not even listed on our questionnaire, but they brought up themselves is, yeah, I'm really scared of stepping outside the house because of the surge of anti-Asian crime that has been going on. When I asked them about what would be the best way for you to feel safer, like what community members could do to make you feel safer, the answer is also very pessimistic. Almost all of them answer, I think hiding is the best way. They use the word hiding. One older adult told me that she thinks, after seeing the news, she thinks like law enforcement are not even helping the young Asian adults and the young Asians who are attacked. So why would they help the older senior adults?
Are there any resources that you direct them to?
Cultural organizations are helping older adults, are helping just Asian community in general to overcome this the surge of anti-Asian crimes. But I think one thing with older adults is that a lot of, for example, Chinese immigrant adults, they have faced actual language and cultural barriers. So it's really hard for them to even start the step of reaching out. I think that also goes back to something I want to also emphasize for tech access, is that the hardest thing is not, there's no resources. The hard thing is to get people out there to seek for resources, especially among immigrant population. If there's no motivation for them to even get there, if there's no trust for them to even get there, then they will never get help.
If you could share something that inspired you to enter this kind of work, can you share something that made this a passion for you?
I am the child of immigrants, and I feel very beholden, and I have always really admired Meals on Wheels and other organizations like that, which really helped me when my parents were older adults on the Upper West Side. And I am myself on the board of the Westside Interagency Council, and I feel that I'm paying back, all of the help that I got from my parents.
I came to the space from like an economic justice point of view, and I've been working on taking on monopolistic growth of big corporations at the beginning of my career, fighting companies like Amazon. But I think recently, what really connected the dots for me from having spent years fighting for economic justice to now the care sector is when I met an author named Riane Eisler, who wrote The Real Wealth of Nations. And I think she runs a organization called Center for Partnership out in California. And I've had quite a few conversations with her over the last few years. And just understanding the history behind dominating models versus partnership-driven models, and the work that we need to put in to really create a caring community and caring society. At the very macro level, like it was very inspiring, but at the local and grassroots level, and in terms of translating all that their theory into policy in real time, is really consumed my time, because it's undoing decades of conditioned thinking of how economy works, all the way to how we treat people at the very local level. And there's no reason why we're paying Amazon delivery workers $10 more than a home care worker in upstate New York. I just don't want, we continue to make the same mistakes. And that's why I feel very passionate about getting this right.
I have worked my whole life with and about people where who they are determines what their opportunities are. I began my work life in reproductive rights, and worked for 30 years in HIV/AIDS, where so much of how we understood that disease and condition was based on our narratives and our construction of who had that disease and how they got it, and making moral judgments about them, and moved on to working with active drug users, another group of people who are a priori judged, and people in prison. And to me, that's a linear path to aging, where our identities determine our possibilities rather than our contributions and our potential. I don't feel like being old is different in kind from being all sorts of other things. And the more that we come to recognize that we are allowing ourselves to be driven into a set of presumptions and prejudices that are limiting all of us, the sooner we all get an opportunity to contribute.
I grew up with my 4 grandparents. It's really usual in my community to, be left with their grandparents, and I grew up with them. After I came to college, my grandparents have told me that the feeling of loss in their life, they have done their missions, they have raised their kids, they have raised their grandkids, and it's done for them. Like, they just feel like, oh, then now I'm just waiting to death. It's really sad that like a lot of our older adults have internalized that kind of limitation the society has imposed on them. So I guess I really want to join this type of work to, echoing everyone has said, to create more opportunities for older adults, to let them feel that they have more rules. Like, aging is not a disease, but it's just like another course of life. They will adopt new rules every day. And maybe as you said, Nancy, as you echoed before, older adults can also be TikTokers. Older adults can also be employees. Older adults can also be customers. So I want to, join this kind of force to adopt this mentality to create more opportunities for the adults that they don't seem to be they don't really adopt that kind of living mindset themselves, and to create a safer and more comfortable living environment for our older adults, as we are going to be older adults later.
This was really amazing for me, and I think that it'll be really valuable to all kinds of people. I have a 6-year-old son, and something that is happening within, the educational realm is the idea of critical race theory and, looking at what we used to think we know, what we thought was unshakable truth about history, about science. There are a lot of people that are very actively fighting against that happening in schools. And something that always occurs to me is that no matter who you are, the time that we're in, we have to rethink everything we know to be true. And if you think you know something about what it's like to be an older person, what it's like to be an Asian person, what it's like to be Jewish or Black, unless you are that person, you don't know. And what happens to the people that you encounter and live among affects you, whether or not you want to acknowledge it. Thank you for helping to adjust our attitudes and to educate us. And I hope that we can all support your work and support your passion.